Okay, well, thank you for joining us this rainy evening. Hope it doesn't storm or have lightning during this presentation. We hope we'll get through it for you. So we're going to cover all aspects of Medicare, and it's just really educational. We'll get into some detail, but this is really good for just a basic beginner understanding of Medicare. So the topics we're going to cover today are Medicare eligibility, then how to enroll. Then we're going to talk about the different parts of original Medicare. We'll go into the types of supplemental plans that you can use with Medicare to give you full coverage and not leave yourself exposed to unlimited out-of-pocket expenses. We'll also talk about the prescription drug plans, and we'll also talk about the Advantage plans. So we'll cover all aspects in a high-level manner, and then at the end, we'll certainly take some questions through the chat room. And then, if you have further on questions, you can certainly ask us after the fact. So here we go. So Medicare, if you don't know, it's the federal law that was signed back in '65. So we've had it almost 60 years now. And it's the Medicare medical coverage for seniors. And it consists of different parts. And you'll hear us talk about parts A, B, C, D, and then we'll talk about plans. So I'll try to differentiate those because that can be confusing. So when can you sign up for Medicare? Well, you're first eligible for A and B, and most of the time it's when people are turning 65, and you have a 7-month window of opportunity to sign up for Medicare, and that's 3 months before your birthday month, and 3 months after. If you happen to be a lucky duck and have a birthday that's on the first of a month, then you can start Medicare a month earlier than everybody else. But just know that when you're approaching age 65 and you think you're going to go on Medicare, don't wait to the month before your birthday to get signed up for Medicare, because it is a government-run program. So give the folks time to process your application and that type of thing. So if you ever have questions about how to do it, we can help you with that, but we'll cover some of that this evening. But main thing to remember is don't procrastinate. So Medicare, and this is actually, if you want to make note, page 7 in one of the handouts called Medigap and You, I think. You'll be getting that this evening. This is page 7. And if you do nothing else but know page 7 and page 11 or mark those, you'll be head and shoulders above a lot of the other folks. So if you look on this particular slide, on the left-hand column is what is called original Medicare. And the right-hand column is something called Medicare Advantage. And we're going to cover both parts, but we're going to start on the left-hand side. Original Medicare comes in 2 parts. Part A, which is your hospital coverage. Just think about it as hospital coverage. And Part B, doctor coverage. So we'll go into that a little bit more. So hospital insurance, think of it, it's inpatient care in the hospitals, nursing facilities, hospice, home care. The second to the bottom bullet point, there's a deductible for this coverage. Let me back up a second. Part A, your hospital coverage, if you have worked 40 quarters or 10 years of your life and have had payroll taxes taken out for Medicare during that time, your Part A will be prepaid, or it's not free. Believe me, we all work a long time for that, right? But you won't have to pay any further cost to get Part A. There is, however, a deductible, And that's if you go into a hospital that, for instance, you pay $1,632 deductible before your insurance kicks in. And that seems like, okay, but guess what? That's a per occurrence deductible. So if you're very unlucky and have multiple things happen throughout the year, you might be paying 1, 2, 3, 4, or more of those $1,632 deductibles. So just be aware, Part A has a deductible, but it's no further premium. The Part B, which is your doctor's insurance and some other things like durable medical equipment, there is also a deductible for that. And that's $240, but that is per year. So there's a one-time $240 deductible, and that's it for the Part B, except the Part B, unlike Part A, is not prepaid. You have to pay for it. So it's a new expense. We call it the premium to get into the Medicare club. It's what you have to pay every month once you join Medicare. And it's your Part B premium. And that's this year is $174.70. So once you decide to join Medicare, just know that you're going to have to start getting that $174.70 paid every month. Now, if you're on Social Security, which a lot of folks are, that amount will be taken out of your Social Security check. But if you're not, a lot of people decide, well, I may want to continue to work, or I'm at least not going to take Social Security right now. The default payment for that is a quarterly payment. So the government will bill you 3 times $174.70 for a quarterly premium. Then if you wish, you can set it up for a monthly draft from your bank account. But the upfront cost is 3 times $174.70. So be aware of that. Just a little aside, if you are a high earner, or your joint household is high earners, you may be subject to an adjustment in that $174.70. It's called a IRMA adjustment. And basically, if you are a high earner, Uncle Sam gives you the pleasure of paying more for your Part B. You will know about it because the IRS will contact you and tell you that. But just be aware that it could be adjusted if you are a high earner, and they look back 2 years in your tax returns. So just wanted to point that out so you're not surprised. So, well, let me go back here a second. In A and B coverage, the original Medicare, A and B, hospital and doctors, is only so-so coverage, right? Even though the premium is $174.70, you do have a deductible, couple of deductibles, and it's like, but most people could say, yes, we can afford that. However, that's not the whole story. And the biggest, if you remember nothing else about this presentation, remember that if you only get A and B, you are setting yourself up for unlimited risk. And here's why. So I'm going to go on to the next page. And this is an excerpt out of one of the books you'll get tonight. This may be last year's version. You'll find it around page 29, I believe. But I just want to show you this one sentence. You can kind of see where my cursor is. It's the second paragraph from the bottom in bold. There's no yearly limit for what you pay out of pocket. So if you have A and B only, you sign up for Original Medicare and nothing else. Original Medicare is designed to pay about 80% of your medically necessary costs. The last or remaining 20% is on you, and it's unlimited. So to kind of illustrate this, if I'm walking outside and I get splatted by a bus, and I go into the hospital, And a month later, I get out after having multiple surgeries and all kinds of things, and my bill is $1 million. And I say, no, 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 I have my red, white, and blue Medicare card. They say, well, very good. Give us the 200,000 because it only covers 80%. So that amount that you're on the hook for can be unlimited. So that is why a lot of people look to other forms to fill those gaps, other insurance to fill that remaining 20%. So we'll go over those types of gap fillers here this evening. But remember, if you don't do anything else, you're still at risk, at a very high risk. So I'm popping back to that page 7 again because it's a really good illustration. So if you move down on the left-hand column, and we talked about parts A and B, we're going to skip D for a moment, and we're going to jump down to the very bottom, and it says you can also add supplemental coverage. So this supplemental coverage that we're going to talk about right now is pure insurance. It's where you go to an outside insurance company and you pay a premium, and that outside insurance company is going to plug that 20% gap. So that supplemental coverage comes in many different forms, and we'll talk about that right now. So one thing about Medicare, you have to remember it covers medically necessary services. It is not up to us to just decide, oh, I need this test, I want this facelift or whatever. It has to be deemed medically necessary. But when it is, then Medicare will pay that 80%. And depending on the type of supplement coverage you choose, you can plug the remaining of that gap. Because it's with an outside insurance company, or many companies offer these supplement plans, you can choose the company and the price. All plans, and I'll show you this in a minute, plans are labeled by type. So there's like an F plan, a G plan, an N plan. All those plans are set by law to be the same, but the prices aren't the same. The companies that offer them are not the same. They don't have the same rate increases or history of rate increases. So you have to be careful when you decide to use one of these companies, so you get a company that is going to be good for you for the long haul. One additional fact, you need to have your A and B in place before you can get a supplemental type coverage, any of the supplementals that we're talking about today. So you must have A and B and start paying that $174.70. And then the company you choose will have a premium, so you have to pay that. And then we'll talk about drugs separately, but if you want a drug plan, those are in addition. So this chart is on page, if you want to make note, page 11 of the book that page 7 is in. So if you go between 7 and 11, that will be the biggest help, and I think kind of a memory jog for you. So what we have here on the screen is just a chart that shows the different types of Medicare supplement plans. I can tell you just from experience, the ones that are really worth a hoot are F, G, and N. We start with F because that has been, over the years, the most popular plan in the nation. It is no longer the most popular plan because it hasn't been offered now since 2020. If you turn 65 after January 1st, 2020, the F plan is no longer available. But I use it kind of as a benchmark. As you can see, if you go down, if you find the F across the top row, and then go down the F column, you'll see that the F plan covers everything, 100%. So no wonder it was very popular. If you kind of go down the row or go down the column on that F plan. So like that Medicare Part A deductible, that's $1,632. It just covers it. You don't have it. Even if you had 5 incidents a year, it would pay every one of them every time. So no wonder people love that F plan. Then it also paid, if you look one box underneath that, one row underneath, the Medicare Part B deductible, that $240. And then so on, the foreign travel emergency and that type of thing. So given that F plan was so popular for a while, we joke in our family that, oh, I guess the senators were sitting around one day and said, oh gosh, have you seen that F plan? It's just too good. We can't let the folks have the good plan like us. So the G plan now, it was really a cost-cutting measure, but the G plan now is the most rich, the fullest benefit of the supplement plans that you can still purchase. So if you look at the G plan, you can kind of see all the way down, it covers that darn Part A deductible. So that's good. But there's still that $240 doctor deductible, that Part B. If you notice, that area on the G column is blank. So what that's telling us is that we would still be responsible for that $240 once a year. I call it the doctor or Part B deductible. It's definitely not as bad as a $1,600 plus deductible, but just wanted you to be aware that that's the difference between the G and the F plan. The G plan, if you think, wow, that's really good insurance, I bet it's really pricey. Well, I'm assuming, or most people in Missouri, I'm assuming, I'll just give you kind of Missouri rates for a G plan with a good stable company here in Kansas City, Missouri, is about $170 to $200 a month for a female, and about $190 to $220 a month for a male. So that kind of gives you an idea of, all right, how much will this cost me? And I realize we all come to this with different perspectives. Some of us who've had really good employer insurance might pay a lot less than that and think, oh, this is very expensive. And other people who are perhaps self-employed, who are paying well over $1,000, $1,100, $1,200 a month before they turn 65, are going to, get down and on their knees and thank us. It's just all in your perspective, but just kind of use as if you're taking notes, I would put down 170, 175 for females, males 190 to 200 per month. So that gives you an idea. But just remember, you have to add in, you've already started the Medicare club, and what was that club fee? That was $174.70. So $175 just to get into Medicare, and then add on another $175 or $200 for a Part G supplement plan. So you can see that we're quickly in the 300 mark and rising. One of the other options that you might want to consider is the N plan. So if you go all the way to the far right on this chart, the N plan, as you can see, is very much like the G plan. There are a couple of little asterisks and one little kind of explanation. The N plan, once you pay your Part B deductible, that $240, the N plan can still require you, or does still require you, to pay deductibles of up to $20 per visit every time you use the doctor. So if you use the doctor a lot, you might be thinking another plan would be better, because that can add up. So think about it as $20 every time you would use services. Also, if you would ever need an emergency room and you go into the emergency room and they don't admit you, the N plan will charge you $50. The G plan wouldn't. And then there's some excess charges if you use a provider that doesn't accept what Medicare pays and they charge you more, Medicare isn't going to reimburse that difference. So there's a few little caveats there, but end plans are becoming more and more popular because they are a little less expensive. So think of the G plan I gave you, those rates, and maybe take off $20 to $30 a month difference. So you would save that much, but then you'd be on the hook for some of those deductibles and emergency room visits and things like that. So let's pop back to our page 7 and let's just kind of go through it again so we have it in our minds. So if you take part A, if you remember, if you've worked your 10 years, 40 quarters, part A is what? It's prepaid. Part B, once you start that, that's going to be $174.70 a month. And oh, by the way, that's the 2024 rate. The 2025 rate is not finalized. Currently, the estimate is $185 a month. And these amounts will go up each year, roughly, $5 to $10. Next year, think about it, $185. For those of you who are still several years out from Medicare, you'll just have to look at those rates. You go over it with us when you're getting closer to your time to hit 65. Then we jump down to the supplemental coverage. We get let's say a G plan, and we're going to pay $175 for it. So if we add our Part B, which was roughly $175 and a $175 premium, we're right at $350 a month for coverage that is extremely thorough. Your other charge would be that one-time $240 Part B deductible. But guess what? That's not all. You have a Part D, our drug plan, to consider. With Medicare supplements, drug plans are not included. So you need to have a separate Part D drug plan. And you do that by going to yet another drug plan or yet another insurance company. And these are companies that offer standalone drug plans. It would be really lovely if all drug plans were the same, but guess what? They're not. They're very different. And they're geared to different people because each of us have different prescriptions. They're very unique, and it's not something we even suggest trying to do alone because it can be very complicated in trying to determine the best drug plan for you. And I'll explain a little bit about that. So prescription drug plans, you can get them as standalone drug plans, like I just mentioned, or you can get them through an Advantage plan, and we will go through that here in a second. Prescription drug plans are, just remember, they have different components. So you choose a plan, and every plan is different because they have different formularies, meaning the list of drugs that they will cover. And they also have different pharmacies that they work with. So maybe last year you had one drug plan and you would always go to, let's say, Walgreens. And then the next year comes around and now your drug plan has changed, or they've dropped Walgreens, and now you have to go to CVS. So it varies. They can change during the year. And because the government knows that prescription drug plans do change, they give us the opportunity to change our drug plans every year in the fall during the annual enrollment period. You'll see a lot of advertising on TV in the coming months, but it's October 15th through December 7th. You can change your drug plans. So be aware that they change and that you have to kind of keep up with them, or you can be surprised when you go to the drugstore and your drugs are not covered any longer. And if you look at the box right at the bottom of that screen, guess what? There's another little monthly premium that you get to pay with that as well. Now, they're not as high. Some of them are as low as $0 for the premium, but you still have to pay for your prescriptions. So think of it as you pay for a drug plan card that gives you a discount. And then you go to your in-network preferred pharmacy and you get your prescriptions, but you still have to pay for your prescriptions. But if you go to your in-network preferred pharmacy, you get lower costs on your prescriptions than you would if you went to another pharmacy or like out of network. So now we're going to pop back to our favorite page 7. So now in the left-hand corner, we know Part A is 0 additional dollars. Part B, $174.70 or $175. Part D, let's just assume with your premium and your prescriptions, maybe $50. A lot of people are less, a lot are more. And it's really, you have to look at your own individual situation. We can't just guess because it is so unique to you and your prescriptions. And then your supplement, you add that $175 for a supplement. So all in on the left-hand side, just estimate about $400 a month or a little less if your prescriptions aren't quite as expensive. All right, so now that your heads are swimming, we'll go on here and talk about the right-hand column. We'll go back here. The right-hand column of the page, Advantage plans. This is a whole different animal. So let's just forge on through. Advantage plans are the ones that you hear about on TV and that you will get mailers about when you're getting close to turning 65. It's what everybody talks about. Like, oh, I got my over-the-counter benefits. I got this, I did this. They're the ones with all the little perks. It's not pure insurance like supplement plans are. The supplement plans are you pay your premium and then the insurance company pays what Medicare doesn't. On this side of the equation, on Advantage plans, it's truly managed care. And in this case, Medicare has gone out and said, hey, insurance companies, we're going to get out of the business. Do you want to take all this money that we've collected and take over for us in Medicare with the Advantage plans? And all these insurance companies say, yes, we'll take over from you, Medicare. We'll do our own plans. So it's a managed care plan offered by different private insurance companies. And they include all the benefits that Part A and Part B did. And they usually throw in something else, or I'm saying Part A and Part B do provide those benefits. Then you get into prescription drugs. A lot of the Medicare Advantage plans include the prescription drugs, so there's not a separate expense like on the left-hand side of the equation. And the Advantage plans also include some perks, like they might do dental coverage and vision and hearing. What you need to understand about Advantage plans, though, is that even though this sounds really good because they include my prescription drugs, and they're usually really inexpensive. This year, most of them in our area were 0 premium. It's like 0 premium. Well, how can they afford to give us 0 premium plans when we have to pay for plans if we go the supplement route? Here's the answer. When you start using Advantage plans, you start paying for them. They have rules like, oh, our plan, if you go into the hospital, you're going to pay $450 every day for the first 6 days you're in the hospital. Another plan will say, oh, you have to pay $425 for 7 days. I'm just making things up, but you kind of pay as you go. So you really don't know exactly how much it's going to be, how much you'll have to pay each month, because you don't know if you're going to get sick that month, for example. And those plans can change from year to year. So on the left-hand side of the equation, the supplement plans, you pay a premium, you know what you're getting. By law, all the Plan Gs are going to be the same from each company. The Medicare Advantage plans are very different. Each one of them is different, and they can change each year. Your providers can be in or out of network throughout the year. So it's a little more upkeep, because you have to understand what your plan covers and what it doesn't. The good thing about Advantage plans, and why they're called Advantage plans, is that when the government outsourced these Medicare Advantage plans that are mostly HMOs and PPOs, they said you have to do something that's an advantage to the clients. So in addition to like a zero premium, they capped the out-of-pocket that you will expect. And that can change each year. So they might say something like, if you stay in network, your maximum out-of-pocket cost this year will be $3,500. Your maximum out-of-network cost could be $6,000. Those change each year. I've seen them go up and I've seen them come down, and we expect that they may be creeping back up next year. But know that they do cap your out-of-pocket expense, and a lot of folks like that idea as well. And additionally, the Advantage plans are the ones that have all those little perks, over-the-counter benefits, gym memberships, things like that. And they can change each year as well. So when you do look at those plans, I would suggest buying or making your selection on the medical benefits and not necessarily on the perks, because they can and have and will be taken away. That's the Advantage plans. Now, let's think about the cost on that. To get an Advantage plan, you have to have a Part B, so that's that $175 Part B, but there's no premium. There's no Plan D or drug premium, but you'd still have to buy your drugs. So these come in overall about whatever your sub plan premium would be, maybe about $175 to $200 less a month. And some people like it because of that, even with the idea that it might be a little more uncertain. So just remember, you have a monthly premium, maybe a monthly premium. Right now, they're very low. Maybe a deductible. And these are all, underscore the maybes. You just don't know. They'll sometimes make you pay co-pays, which is a flat amount. Co-insurance, which is a percentage of an amount that you usually don't know. They are network driven. So some are very restrictive, and some do advertise that they have nationwide out-of-network access. In contrast with the Medicare supplement plan, when you stay on pure Medicare with a supplement, you don't have a network per se. Your network is any provider in the United States or territories that accepts Medicare for reimbursement. So you really don't have a network. You just go to some provider that takes Medicare. And then, of course, if you max out your cost, you reach the maximum out-of-pocket cost for your Medicare Advantage, you don't have any more expense that year. So that's the difference between an Advantage plan, is really you're working with a managed care HMO PPO, and you pay as you go. On the left-hand side of the equation on that chart, you have more stability. You know how to plan, and it's really kind of a preference. I do tell people that the only really wrong decision, in my estimation, is not to do anything except take A and B only. And the reason why is that 20% of a non-capped number, you could be out 20% of $100,000 pretty quickly these days with even just minor medical issues. So I just wanted to compare and contrast those so you can kind of get in your mind how much things would cost if you went down the pure supplement route or if you went down the managed care route. And then I did want to mention that your Advantage plans, most of them will include the drug plan. There are some plans that don't, and that's usually to accommodate our veterans who have drugs available through the VA. So that's kind of the managed care plans and the supplement plans in a nutshell. And then last, I'm just going to mention overall Medicare. If you can remember this, and I think it makes it pretty easy to remember. If you think about those three little monkeys that sit in a row, see, hear, speak no evil. So no dental coverage, no hearing coverage, and no vision coverage. That Medicare doesn't include any of that. If you want dental coverage, in addition to like a supplement plan, for example, you can buy standalone dental plans. You can get them through some of the Medicare Advantage plans include dental coverage. When we get questions about, well, which dental plan should we use? We typically say check with your dentist, because some dentists will do a discount plan. You pay a premium or a fee, and then you get so many 2 cleanings a year and then a discount on any other service throughout the year. I think those are pretty effective. You can look at some other larger organizations that have dental plans, but typically when you really start peeling back what a dental plan provides, it doesn't provide a lot of coverage. So you may be surprised down the road. I would just say proceed with caution and really study when you get supplemental plans. Chris, did you have something you wanted to add?
Yeah. Can I just kind of reiterate from?
Sure.
So again, Medicare is for two types of people. One is for people who are turning 65 and then have already retired or have never really worked. The other one is for folks who are ready to retire, and they could be 65 or 70. So as she said, there's your A and B. A is already prepaid for you. B is a new expense. How do you sign up for these things? Well, you have that 3-month window beforehand. You have the birthday month, and you have the 3-month afterwards. You sign up either by walking down to a Social Security office and or calling the Social Security office, not a Medicare office. There's no such thing as a Medicare office. You will enroll through a Social Security. We have the phone numbers for the local people if you want. You just go ahead and call us and we'll give those numbers to you. So that would be, the government wants you, actually demands that you get on Medicare. If not, you're going to get a penalty. The only variance to that is if you're working and you're going to continue to work. And even then, I would advise you, since you've already paid for Part A in advance, that you go ahead and sign up for Part A anyway, and then hold off on your Part B, since Part B costs more, until you're ready to retire. So that's really all I wanted to say, Andrew. You're right there.
Oh, okay. Okay. So I think we can go ahead and maybe do questions. I know I covered a lot, and I'm sure people have heard a lot of different things they have questions about or have specific questions. And if you don't want to talk online, you're certainly welcome to call us after the fact, because I know a lot of this is kind of personal info. So I'll just turn it back to you, Cheryl. And I don't know, do you want to open the chat line? Is it open?
Yeah.
Oh, okay.
The chat is open, yeah, and I can read off the questions.
Oh, if you wouldn't
people
mind.
type them in, yeah. I do have a question myself. If you turn 65 and you're continuing to work and you have employer provided coverage, you should, do I understand correctly? You should still go ahead and sign up for Part A, but not for Part B, as long as you have employer coverage?
Yes, but there is one exception. Andrea, tell her what that might be.
Oh, okay. If you have an HSA through your work, you can't have Part A Medicare and still contribute to an HSA.
Okay,
So
Okay.
if you don't have an HSA, then sure, go ahead and sign up for Part A. There's no further cost, and it might help you a little bit should you ever have a hospitalization.
okay. What about an FSA? FSA instead of an HSA?
There's no
No limit?
there's no restriction for that
Okay.
I know.
Okay, our first question, can you please summarize what parts of Medicare are mandatory?
Well,
I'll answer.
good. Go ahead.
The ones that are mandatory, Part A and Part B and Part D. So that is, A is your hospital insurance, Part B is your doctor's insurance, and D is your prescription drugs. If you don't have Part B, they're going to fine you someplace for a late enrollment penalty. And if you don't have Part D, the prescription drugs, they're going to fine you again for a late enrollment penalty. So it behooves you to go ahead and get this process going, or because they're going to catch up with you, believe me.
I'll bet, yeah. Okay, I've always heard that if you don't sign up for Part D, you will be a penalty later if you need Part D. I will have TRICARE for life for my supplement and will receive any pharmacy needs through them, but do I still need to enroll in Part D?
You do not. TRICARE for life is as good as it gets. And it exempts you from the other things. Unless, of course, the TRICARE dries up and then you have to go on to Medicare. And then you'd have to start your Part D at that point. But I don't think you have to worry about TRICARE for life.
Is it possible to transfer from a Medicare Advantage plan to traditional Medicare later on in life if your circumstances change?
And do you want to take that one?
Sure. Yes, if you're healthy. So if you have, and that's just kind of a general answer. Just think of it as if you're down the road now and you have been on Medicare and now our Medicare Advantage, and you realize, oh my gosh, I have something that's wrong with me and I'm going to be going to the doctor a lot. I want to get on one of those really good supplement plans. Well, insurance companies aren't going to want to take you if you are a health risk. When we all are first 65 years old or get on Part B or get on Medicare Part B for the first time, we have a one-time kind of get out jail free card that even if we're very sick, all these insurance companies have to take us. So it's really, I'm not saying it's impossible. You can certainly change, but it's not guaranteed.
I have a question.
Excuse me 1 second. Let me kind of just go back to that.
Oh,
You can
okay,
al-
sorry
you-
about that.
Excuse me just a second. So you can always go back to from a supplement plan to an advantage plans, but you cannot go to an advantage plan to a supplement plan unless you pass the health questions. Does that make any sense? So in other words, since the companies have already been paid with advantage plans, they'll take anybody, sick
Okay.
or not. But the
Okay.
supplement plans, since they're not getting paid by the government, you see, they don't want to take a bad bet. So they're going to be pretty persnickety about it. I'm sorry to interrupt, ma'am.
No, and you can also go from Advantage plan to Advantage plan. So, and that's every year during the fall, annual enrollment, like their drug plans. You can also change your Advantage plans at the same time to go into effect the following January. So if you find that you're on an Advantage plan, you don't particularly like it, but you like the Advantage plan kind of scenario, you can look around or shop around, or we can help you find one that better meets your needs, and you can switch each year that way as well.
Okay, I have two questions for you. Your little square here says Medicare helpers. Does that mean you will help us find the plans that's good for us?
Absolutely.
Or is that what it's for?
Yes, good, good for you. Good for you.
We will,
Okay.
Brokers, we're,
in addition to that, Allison, we'll help you sign up for Medicare too. There's different ways to do it. The easiest way is just kind of to call us and we'll walk you through the process online.
Okay,
Just-
second question.
Okay,
I'm a veteran and I get most of my medical and everything done at the VA. How
excellent.
does that affect my Medicare?
Good for you. There's our special plans, as Andrea was going to say, special plans that will help you. Most of the folks don't ever mess with Medicare too much other than make sure that they're not going to get stuck with a late enrollment penalty. But they also will sign up for a Medicare Advantage plan generally because they might not want to go to a VA doctor all the time. So they might just,
That's true.
just, just for convenience, if the doctor is down in the program, then why go to the VA doctor if it doesn't cost you anything to go there? So yes, there are plans that are made specifically for veterans, and they're tailored for that reason.
Okay, thank you.
Sure.
Okay, I've got a couple more questions in the chat. How long does it take to get covered once you apply? I am retired and on COBRA. My COBRA will expire on November 30th, 2025. I turn 65 in December 2025. If I apply for Medicare as soon as I can in September 2025, will it actually be in place for me on December 1st so I won't have a lapse in coverage?
Yes.
you can apply. I would not wait. You are exactly right. You can apply for Medicare starting September, 3 months before your birthday month. I
3
wouldn't,
months before your retirement.
are you retired, but they're coordinating that.
Right. Yeah.
So apply in September. You are working again with the government, takes a little while, but sometime in early October, I would hope you would have your red, white, and blue Medicare card that would show your Medicare start dates as December 1st, 2024. And then that's what you need before you can even enroll in any of these other plans, whether it be supplement or drug plan or advantage plan. So enrolling is step one. You have it just right. And don't procrastinate, because at the end of the year, everybody gets busy and there's a lot of holidays. So I'll just say, don't do what my dear husband did
Oh, no.
and apply for his coverage at 10:30 the night before his birthday month. So just don't do what he did and you'll be good.
Okay. Here's a question. I'm on Missouri disability. Do I sign up for A and B, or will it just roll onto Medicare? Who should I talk to?
I would say talk to Social Security, but it will roll on. And then when you're turning 65, they will automatically enroll you in Medicare at that time.
They will automatically. Okay.
That's right.
Okay.
But then there are other plans. Again, I hate to say it, we are helpers. We're not salespeople. We're just helpers. So if you have any trouble with that, there are different plans, again, geared specifically for folks on disability, just like there are certain plans that are specific for veterans. It's the same thing. So we will go ahead and just explain those things to you when the time comes. I'm sorry,
Okay.
Andrea, did you go?
Here's
I
one.
think
Oh,
I'm
sorry.
not sure if the question was, if you're a younger person and you've been on disability for 2 years, then you do become eligible for Medicare at that time. So let's say you were younger, you're only 60, but you've been on disability for 2 years. When you reach 60, for example, you can get on Medicare at that time. And then again, when you turn 65, you have an opportunity of kind of a do-over. But as Chris said, just, give us a call or do some research around those times, because there are some opportunities unique to that situation.
Okay. Why are 65-year-old seniors mandated to pay for Medicare? The monthly premium is way over what I used to pay with any employer I ever had. Are there resources for assistance to pay the monthly premiums, especially if you are unemployed?
Yes. There are special for low income subsidies and again, certain programs for that as well too. And you're hitting all those kind of specialty things, and I'm sorry that we didn't cover all of that stuff. We're just limited for time. But the answer is yes, if your income level is under a certain amount, there's lots of different financial assistance programs, and we'll help you find those as well too.
Okay,
Let me say, the reason why they don't mandate that you get on A and B. You don't have to get on A and B. It's just then if you ever decide to get back on A and B, you have accrued a long financial delayed penalty. That's all.
I have a second question or a third question, if I may. If I
Sure.
remember what I was going to say, just a second.
You sound like me, Allison.
I know, brain dead. Too many rounds going off near my ear. Never mind, I forgot what it was.
Okay.
It's gone. Sorry.
All right.
happens to the best of us.
Tomorrow.
Okay, we do have an open chat. If you have any questions, please feel free to put them in the chat.
Yeah, what are your hours at your office?
Well, since we consider ourselves self-employed, they kind of roll over a bit in our office. We're here roughly 9 to 5, Monday through Friday, some weekends. The best way is just to call our number to make sure we're here if you want to stop in. But pretty much this time of year, going into the fall, we'll be here at least 9 to 5.
Okay, thank you.
Okay. Okay, any more questions? We've got an open chat. Okay, let's see. Oh, okay. Why did the government decide to make seniors pay for Medicare in the first place?
Yeah.
I love it. Well, I don't think that they started out that way. I think, I mean, now you're going to see the cynical side of me. I think that Medicare is one of those things we've been putting into. I mean, that's our money there. And they just so happen to squander it with other things, paying for other things. And now they have to make up the difference. And that's why we have to do deductibles, and that's $1,600 every time you go into the hospital, or you have to pay for Part B. And so in order to kind of protect ourselves from their, you know, then that's why we have to do these other kind of additional insurance policies. I am on the part of the US government. I apologize. I'm trying to, we're just trying to help soften the blow.
I remember the question I was going
Okay,
to
good.
ask. Okay, come on, Allison. I don't believe this. Okay, let me think. No, dang. Never mind. Gee,
You know,
I have to, when I
have a
remember, I'll write it down and I'll call you.
Okay,
Okay.
I have a question in the chat. First off, I have one thank you for your presentation. It was helpful to me. And then also, does the fine or penalty apply to Part D as well as Part B?
Yes. They are, the math to them are a little bit different. Part B is just, the calculus is just different. But yes, both of them, B and D, will go ahead and accrue a penalty. And the darn thing is this, they don't ever go away. Once you get stuck with that penalty, they just tack it on. So let's say, as Andrea said, Part B is $174.70. But now if I have another $30 penalty because I delayed and I didn't do what they wanted me to do, then all of a sudden, instead of 174, I'm stuck with 204, right? And that just lives with me. And in addition to that, then they might stick another $20 onto my Part D prescription drug, and that never goes away either. So sorry to say, it's the government at its best.
Okay, can you sign up for Part D 3 months after your birthday month without penalty?
Yes.
Okay. Okay, and then one comment. Thank you for that explanation. No one else I asked that question was brave enough to answer it. Okay. Any other questions? Well, I know I had some questions answered tonight, and I am rapidly approaching my D-Day. Let's see.
Okay, I remembered it. I'm
Okay.
sorry. All right, I have Social Security disability. How will that affect me getting Medicare?
Andrew, you want to, or not?
Well-
Again, there are special programs for those folks who are on disability. And so you have two special circumstances going for you, disability and the VA. It's just a
Yeah.
matter, I'm sorry that we don't have time to go into it right at the moment, but we will certainly
make an
look into,
appointment.
yeah, we will certainly kind of give you a array of the options that are available. It's kind of neat that you have two different things going for you, so.
Actually, I got three. I got TRICARE for life.
There you go. And and what I said is, I said before, TRICARE for life, basically, there isn't any better insurance. As Andrea said, that F plan or the old time J plan for Medicare, which is really long past. But man, I'll tell you, TRICARE for life is that's top banana.
Okay,
Yeah.
what
Okay,
exactly
I know
is
that.
TRICARE for life?
It's special insurance provided to veterans after you have
Okay.
a
Special
career
veteran, okay.
in the history.
Okay, here we go. Sorry to ask again to clarify. You said I wouldn't need Part D if I had TRICARE for life, so I'll never be fined for not signing up for Part D.
Correct.
Okay.
What documentation do I need to provide Medicare to prove that I have TRICARE for life?
You mean if you're going to go on Medicare?
Yeah,
Uh,
because I thought once you turn 65, you have to go on Medicare.
Not if you have TRICARE for life, but again, you might want to have Part A since you've already paid for it. I'm
Yeah.
sorry to kind of dodge your questions, but I think it's your
I need to
situation is
I need to come
yeah,
in to see you guys.
it's so specialized that we could talk a long time.
Yeah,
Yeah.
okay. Okay, our questions are dying down. Okay, I did put in a link to our survey, and I also included a link. Mid-Continent has volunteers from Missouri SHIP. I forget what the acronym stands for. It used to be Missouri Claim, but it's basically volunteers who counsel people with Medicare Part D enrollment. So you make an appointment through Mid-Continent, and you bring them a list of what prescriptions you take, and they will work with you to find the best plan for you. And that starts October 15th. And I put a link to that, the different branches that are offering that service. Okay.
That's a really good service, by the way, Cheryl. So
Okay.
encourage that. Yeah.
Have you ever heard of MediShare?
Yes, yes. And this has been a few years ago, I researched it for someone. It's really just people pooling their money and the claims being paid out of a pool, like insurance. What I did discover, though, is if you had any pre-existing condition, and let's say you have diabetes, and then you had a heart problem while being covered, there was some question, at least in my mind, whether that person would get a claim paid because they had this pre-existing condition. So I think it's a great idea. I would just be very careful personally in understanding what pre-existing conditions would be. If you don't have them, great, but if you did, how would that affect any possible claims? I know they advertise quite heavily, but I would do my research.
Okay. Very good, thank you.
Are they not religious based too? Is that right?
Yes, they are. They are.
Okay. Oh, what are the open enrollment dates each year? October 15th through when?
December 7th.
Okay.
That's
October-
called that's called annual enrollment period. Then if you do have a buyer's remorse, you can make a change, a one-time change of if you're on Advantage plans in the first quarter of the year. But by law, you cannot be solicited. Someone can't call you and say, oh, do you want to change? So people won't necessarily reach out to you, but if you do have an issue, you can call them. You can call us if you want to and just say, I'm not sure I like this. But just know that's a possibility.
So as you said, annual enrollment is October 15th to December 7th, and then the open enrollment is from December 7th to the end of March.
Okay, I think we might be at the end of our questions for tonight. I want to thank our audience for coming tonight, and I want to thank both you, Andrea and Chris, for your very excellent information. I really
Thank you for having us. This is a really nice service the library puts on.
Oh.
Thank you very much, you guys.
Oh, thank you. Thank you.
Yeah, I really appreciate it too. And I hope you guys do this again,
Okay.
over and over to help us work our way through the system. Because I tried to record it and my recorder died.
Okay. Okay.
Happy to help always.
Okay, thank you.
All right. Well, I think we'll go ahead and call it a night. Thank you all for joining us. We'll hope to see you in future virtual programs and have a good rest of your evening. Oh, wait, here's one last question. Once you have Medicare, do you need to renew each year?
The only way you can lose Medicare is if you don't pay your Part B premium, but you don't necessarily have to renew it as long as you keep paying your premium.
Okay.
And the coverage is the same thing. You can, on the supplement side, you just pay the premium and it'll keep going. On the Medicare Advantage side, you can keep going on the one you have, but again, we suggest you look at it each year and reconsider the drug plan in it. So keep paying the freight and you can keep it.
Okay, I think we'll go ahead and call it a night. Thank you all. And we'll, like I said, I hope I see you in future programs. Good night, everyone.
Good night.
Good night.